Okay, we're going to go through and fill out a full report. Now, before we used to think of these in New World as 321s. Sometimes you do a 311 with a PCR and everything like that. We have to move away from that. So do not think of this as a full 321. It's going to be a full EMS report, but there's ways that we can go through and make this faster and more efficient. There's also ways that we need to make sure that we're providing the best care and the best reporting for our patients. So right now, what we would all consider 321s, we're going to go through and fill out a full report. So as seen in previous videos, this dispatch is red. Crew info right here, nothing's red on that. That is now blue, so this page is good to go. We're going to skip this repeat CFS. We're going to talk about that in a later video, but that one's good to go. We're going to go into dispatch info. You'll see your unit number or your incident number, and the EMS response number is not applicable. Don't worry about that. You're going to see complaint reported by dispatch. Let's say we went to a sick person. These also have been modified for some of the more frequent choices that we run on, but there you can see there's quite the list. So if you see that there's one way down here that we can go through and input towards the top, please let us know. There's also an ability to, if you're trying to figure out what you want to put in here and you're not really sure where it is on the list, like let's say we're going to look for a pregnancy. We can start to type that in and it'll auto-populate and we can click on that. We're not going to do that one. We're going to do a sick person because I don't want to do a pregnant person on here right now. So EMD performed, emergency medical dispatch performed. So basically any medical advice given over dispatch. 99% of the time it's going to be yes, unknown if pre-arrival instructions given. This is going to auto-populate. However, you can go through and change it for that part when needed. The more information you put in this report, just a couple more clicks, the more information we're going to be able to get out and data track. Type of dispatch delay, none, no delay, is right here. Our unit info should auto-populate. What you'll see here is our call sign as well as our EMS vehicle unit number. Primary role of this unit is fire apparatus. That's going to auto-populate as well. Let's go back to this real quick. Let's say that we're in a reserve. I'm in a different account right now, so this is not going to populate every single apparatus that we have. But our call sign will still stay 131, but let's say we're going to be in a different one. Let's say 151 is reserve 1. So we'll need to go through and change that if you can remember that. But right now, we're just going to keep it as 131. Okay, level of care provided to patient per protocol. This is level of care provided to patient per protocol, not what we showed up with. So let's say for the sick person, we just got a simple set of vitals. We'll click BLS. No real ALS designation there. Our unit disposition is that patient contact was made. This is a big key component here that's going to turn on and turn off different parts of this report. So if I click canceled on scene, you can see my response times are done. If I can't click cancel prior to arrival, this goes through and changes things too. Also brings up my validation score. But we're going to do patient contact made. Patient evaluation care was MFD the main primary care. Was the patient evaluated and refused care? Evaluated, no care required. Patient refused evaluation and care, kind of combative, didn't want to talk to us. Or did we assist messy or rural? So these are going to be your main components. These are not going to populate. You have to click that. As we're going to go through and do a full report, we're going to click MFD primary care. You'll see that patient assessment now turned on. When that's off, that's off. Okay, so primary care. Crew disposition. Did we initiate primary care and transfer to messy? Yeah, let's say we did that. Transport disposition. They were transported by messy. Were they transported by messy with an MFD rider? Refuse transport by MFD 119129 in the off chance, or no transport. So this is another area that we have to go through and fill, but look, now we're blue. Incident address, incident location type. We can go through and fill this out. Let's say for some reason this is on the sidewalk right outside. These also can be moved up and moved around for the frequent types of calls that we go on, so just let us know if something needs to change or a suggestion. Response times. This should be generated by CAD, so this should pull in. This, however, will not be generated by CAD. If I go through and I click this little clock right here, it'll input the time that it is right now. So that then flags these that are out of order. You can also see our timeline sequence is out of order as well. So we're going to go through and change that. Let's say it took us 2 minutes to get to our patient, 1350 approximate. Now this is blue. Response info. Type of service requested is going to be already complete for that, but that can also change. Flag down, walk-in, non-emergent, public assistance. This is what it's typically going to be. This is another big one that you need to go through and pay attention to. Incident patient disposition. This is a required field that we have to go through and fill out. We said earlier that the patient was treated and transferred care to MESI, so we're going to continue that one. This is another tracking or data point that MFD wants to go through and have. This is MESI transport unit responding. Were they coming with an ALS crew or a BLS crew, or do you even know, did you not see them? That's what this means. So you need to go through and click those for whatever type of ambulance was arriving to the scene. Let's say today it was Medic 2 and their ALS. Okay, after that screen, we're going to move to the on-scene portion. So date, time of symptom onset last normal. You'll see here we can put this clock in. That's going to go through and update our times to right now. If you want to do that, you can just type it in. Or what may happen is maybe you run on someone who's been down for a while and they're not necessarily responsive. You can click here and you can click unknown. This is called a not value. So this not value of unknown is something to put in there, or approximate, or not applicable. Possible injury. Let's say the sick person was found just down on the sidewalk. We don't know. Maybe we don't know. Maybe they are injured. Maybe they fell. That's going to be an area that we want to put in. Cardiac arrest. So this is a big one too for you guys to understand. Under here, patient assessment. Cardiac arrest has a whole field that we need to go through and fill out. As long as this says yes for either of those. If I click no, then that area for cardiac arrest goes away in the patient assessment. Okay, those are called visibility rules. So we don't need to fill out the cardiac arrest sheet because there is no cardiac arrest. And then potential system of care, specialty registry of patient. Let's say other, I don't like other. Let's do possible spinal cord injury. Who knows? This is not a required field, but remember, the more information we have, the better for our reporting. Our scene info. There was a single patient at the scene. It was not a mass casualty incident. This auto-populates. Type of response delay is none. However, let's say that we had issue. We can go through and pick some of these if we need to. Response mode to scene. Emergent, emergent downgraded, non-emergent, or non-emergent upgraded. Let's say that we went to this emergent because we're immediate. Type of scene delay, there was nothing there, but maybe this is a crowd, or maybe there was distance, language barrier, all those other kind of things. Those can be input as well. Okay, so now we're going to move to our patient info. Patient info and demographics. This is where we're going to input the name. So let's say we put in Dave Smith. What happens is that this is also going to flag, like New World did, of previous patient records. So if we wanted to, we can go through and click on this and find a repeat patient. This is not going to give us the jacket. This isn't going to give us any police stuff. This is just previous data that we put in. So let's say it's this one right here, female Dave Smith, 11/22/1970. We're going to go through and download that patient information in. So now you'll see that a whole bunch of this stuff auto-populates and brings that up. I also am going to go back through and take this out and show you what it's like without a patient. So I went through and changed out this area, so now this is blank again. So let's say we go through and put in Dave Smith manually. Race is going to populate automatically for unknown race, something to be aware of if you need to go through and change that. The age units are going to come in as 38 years if you go through and put in the date of birth. Let's say you don't have that and you're going to approximate. Let's say we do like 29 years old if we don't get a date of birth, or 9 days old, or whatever it needs to, okay? But if we go through and put this one in, this will automatically propagate. Patient address. Is the patient houseless? There's a lot of debate about this right now and how we want to go through and calculate this and track this. If you arrive at a home and they're living there, then obviously you'd put yes. If you're going to arrive and they are a transient, you can go through and hit no. If there is no way for you to understand or no way to know, you can click unknown here. This is something we're working on currently, but the state criteria and the federal criteria is wanting us to go through and collect data for the patient's home address. So you just need to click this button. You'll see that validation score went up. These areas are hidden right here, but we just need to click that. I'll try and make that mandatory in the future. Here we're going to go to patient history. These are not required items, but this is where you would go through and add in current medications. Let's say that you wanted to just try and look something up. Let's say the patient takes Zofran. We can go through and select it here so you're not scrolling through this abominable list of medications. So that is going to make it easier for you. If it was not recorded, you can go through here and click not recorded. You can also do this button here, which will list them as well, if you're looking for a different way to select your medications. Let's say for allergies, environmental food allergies, anything like that. Looks like Dave's previous patient stuff had narcotics in here for medication allergies, so just to be aware of that. Let's say there was no known environmental or food allergies. Again, not required, but good reporting is trying to fill out this as best we can. Past patient history. So you could obtain the history from the patient, from the family member, from healthcare personnel, bystander, who knows. So let's say you got the information from a patient. If there's any medical surgical history that you can see or that you find out, you can go through and submit those. This is multi-select. So we can go through and click those as much as we want. And then this is an area where you can go through and free type other pertinent medical history. Remember, this is a HIPAA document, so this should be fine for you to type and should be hidden if this was just pulled for a fire report. Scrolling down, there's advanced directives. Pulsed, family guardian requests no DNR, living will, none, other. You can see these are not required, but again, good for us to go through and get as much information that we can. So we're going to say there was none for advanced directives, recent exposure to infectious disease, unknown, maybe possible, who knows. Travel within last 30 days, domestic or international, let's say there was. And then you can add in here pertinent travel locations. Okay, now we're going to move into patient assessment. So this is a big key one. Opening this up, we see for symptoms and impression, we have primary symptoms. So let's say that Dave has abdominal pain lower quadrants. So we need to fill that out. We need to fill out provider's primary impression as well. Other associated symptoms too, these are multi-select, so if there's a whole bunch of other things that are going on, these can all be input. For our primary impression, let's say, yeah, we go through and we see that there's generalized abdominal pain. Again, multi-select for provider's secondary impression as well. Alcohol, drug use related to current illness or injury. If you're going on an OD and you're seeing that there's drug paraphernalia at the scene, or they admit to drug use or admits to alcohol use, this area can be input. Again, that's multi-select. Initial patient acuity. Is this an emergent patient? Is this a lower acuity patient, or is this dead without resuscitation efforts? This is a required field for the Scamantron, so we'll just say it's lower acuity. This date, time, last known well is going to auto-populate if we go through and we put in here for stroke or stroke assessment. So just be aware that's not a required field right now. That can be input, but that's going to be something that's going to be a required field later on. So now this page is all good. Injury information, this is going to go through and deal with trauma. So cause of injury, and this is an incredibly long list, but If you have a trauma force there and it's just blunt trauma, was it from a cat? Was it from a cow? Who knows? There's just a whole bunch of lists in here. MVAs, ice skating rink, exhaustion. You can go through and put that in there for cause of injury. Mechanism of injury, blunt, burn, penetrating, or other. Safety equipment used by patient. This is going to typically pertain to MVAs. So was it the shoulder and lap belt used? Was there a helmet worn for a bike? Was a child in a booster seat? All those things can be filled out as well. Height of fall, feet from for a trauma assessment. If it's 10 feet or over, we can go through and put that. And then that's going to activate our regional trauma protocol as well, that these pieces of information should go through and align with Missoula County and regional trauma protocol criteria. Moving on to patient complaint. This is kind of an important one. This has been talked about as possibly becoming required in the future. Barriers to patient care, if there was language, if they were uncooperative, if there was alcohol use, developmentally impaired, physically impaired. That's a nice little tidbit of information to input. And then here you'll see this complaints buttons, and it says add. If we go through and click this, this is going to be our chief complaint or secondary complaint or other. Multiple pieces can be input here. But typically I go through and do chief complaint. And complaint described by patient, let's say leg pain. And this has been going on for 2 hours. We'll go ahead and hit OK for that. Chief complaint anatomic location, let's say extremity lower, and organ system is musculoskeletal. So these are required fields. We'll need to go through and input those as well. If we move on to this next page, this is going to be vehicle occupant. You can see this is blue at the moment. That's because we have not reported an MVA. If we do go through and report an MVA, this will highlight as red for an area that we have to go through and complete. This first section, main area of vehicle impacted by collision. I'm not super fond of this one. This is a single select. So if you respond to a rollover or a multi-hit accident and there's damage to the front and damage to the back, you have to go through and figure out and determine what is the best area for me to say that the main damage was or occurred. So again, not super wild about that. Can't change that. That's a national thing for us to go through and do. Location of patient and vehicle, we can say front seat left side or motorcycle driver or front seat middle or enclosed vehicle, riding exterior. Go through and choose those. Exterior damage, again, this is going to be more of a provider's discretion. Was it minor? Was it moderate? Was it major? Need to go through and choose those. Airbag deployment, was it deployed in the front? Was it deployed in the side? Was there no airbag deployed? Was it both of those? All of these things are going to be multi-select. Was a patient forcibly extricated? Was a patient ejected from the vehicle? So yes, no, it all just kind of depends on what you arrive to on scene for an MVA. Response vehicle type to scene, so this is going to be typically fire apparatus. Unless you're 119, you can go through and put that information in there as well. But this again is mainly concerning the vehicle occupant for an MVA. Next up, we're going to take a look at provider actions. This can be an overwhelming area, an overwhelming field, and it can be accessed by 2 separate points. You can access it by this main field here or by the power tools on the right side. We're going to go through and just learn from the main field first, and then we're going to talk about EKG imports. So you'll see with this, the only section right here that is saying that it's flagged is vitals. This is saying that's a state requirement that if a patient is assessed, vitals have to be taken. So that's an area that we need to pay attention to go through and complete. We're going to move up here though for assessments. If I want to go through and add an assessment, you can see that it's going to give me date and time of assessment. This may be off from your timeline. So be aware, if your timeline flags red for this, this is going to be an issue. So you have to go through and adjust that, especially if you're adding it in later. So for an assessment, let's say, what was that time? 9:54. So for my assessment, let's say my assessment was completed at 09:55. So that's not going to flag. There's all these assessments here that we can go through and add. Some of those values have been updated to have like normal, not done, and then it goes through and lists everything that it can find. You can also click this little drop down button on the side and it puts all those off to the side over here. So you can select normal for skin assessment, head assessment was normal, face assessment was normal, or was it a asymmetric smile or droop? Was there an avulsion? Was there bleeding? Or did we just not do a face assessment? Was a neck assessment not done? Again, not required fields, but good information to be inputting into your PCR. Lung exam, same kind of thing. Did we have normal on the left side, but on the right side, did we have breath sounds absent? These will go through and update as you're going through and inputting information. You can also go through and do this drop down as well. For your chest exam, same kind of thing. A lot of these are self-explanatory. Where did you go through and do a chest assessment? What did you find? Heart assessment, what did you find? Was that normal? Was that not done? Did you do one for the abdomen? Did you do one for the eyes? For the eyes, was it bilateral? Was it pearl? Was it 1 millimeter? Was it 4 millimeters? Pinpoint, that kind of thing. We can go through and put into this information. This one you can do for each eye. Back and spine, extremity, pelvis assessment, mental status assessment. This one can be a little challenging because you can also put in ANO times 4, but normal baseline for patient, or maybe it wasn't normal baseline for patient. Maybe the patient was combative. All of these things can be input for your findings as well. Neurological assessment 2. If you go through and do any stroke assessment, or your findings for any stroke assessment that you do or that you've done can be input to this. So if we click OK, you'll see that this is saying, hey, this is accepted. If this time was not correct, then this would have a flag next to it, and we would need to adjust that. You would click into it, and you'd find the portion that is not lining up. Procedures. So you can see right now it is flagging flag here for a procedure completed because it's way after the time that we should have completed it in the run form. So we're going to go through and put this as 0955 as well. Was the procedure performed prior to the unit's EMS care? Who was the person that went through and did this procedure? What was their type of person performing the procedure? I'm trying to see if we can have this auto-populate. Looks like it is now, so that's good. That's an update. So let's say that Connor Gordon, who is paramedic, went through and completed this procedure. Procedures can be BGL check, IV start, IO start, IV CPR, calling medical control. All of these things can go through and be input into this procedures page. So if you're going to go through and start an IV, let's say that's what we're going to do. We're going to do an IV start. We're going to use an 18 gauge because we're not going to use any other one. Number of procedure attempts, we're going to say 1. Was it successful? Yes. Where did we get that access location? Let's say AC on the left. Was the patient's response to procedure, was that improved? Was that unchanged? Was that worse? And then any additional comments that need to be input. So if we go through and click this one is accepted. Medications is the same kind of thing. This is going to go through and flag and say that we did not do this at the right time, so we're going to say we did this a minute later. Was it administered prior to EMS care? No. Who was the crew that went through and did it? Maybe Connor Gordon, who now populates as a paramedic, gave adenosine or albuterol or anything along those lines. Make sure that the person that's going through and providing this medication, they have the right licensure for this to be able to give this to. So let's say we did adenosine, and that's already going to populate as an IV. We can go through and change that if we need to, but we shouldn't for adenosine. Let's say our dosage, we're going to go through and put that in 6 milligrams. Was it improved? Was it unchanged? Was it worse? Medication response or medication complication. Was there diarrhea? Was there bradycardia? Anything along those lines, and additional comments can be made here. On this vitals portion, we're going to go through and add some vitals in here. Again, time is wrong because I'm doing this at a later date. Were they obtained prior to this unit's care? Was there an ECG rhythm that we went through and took? Let's say it was normal sinus. What type of ECG did we take? Just a normal 12 lead. Method of interpretation. Was this computer interpretation that told us it was normal sinus? Was it manual? Was it transmitted to us with no interpretation? Going down here to BP, this is one of the required fields. Let's say it's 152/85. That's going to go through and give us our map. What type of blood pressure measurement was taken? Typically, this is going to auto-populate as cuff automated. However, if you do this manually, you'll need to change this section right here. Heart rate, let's say that they were 85. Pulse ox was 25. And then this is at room air. Respiratory rate, this is required now. So we're going to see probably a lot of 16s, maybe 18s, who knows. Was it normal respiratory effort? Was it rapid? Was it slow? Our monitors go through and take CO2. That can be auto-populated as well when we pull on vitals. And then it's going to be millimeters of mercury that it's gone through and checked. BGL level, let's say it was 101, which we can go through and read. However, if it read high, we can click high. If it read low, we can click low. If we didn't take it, we can put not recorded, but if we need to, we should take it. GCS, if you stay on the left upper corners and it's a fairly standard patient, it's always going to be 4, 5, 6. But if something changes or something that you're assessing has changed, this can be adjusted. And then the Glasgow Coma Score Qualifier. So this one's kind of confusing, but this very top portion, initial GCS has legitimate values without interventions such as intubation and sedation. So 90% of the time it's going to be this one. But maybe there was something that happened that made the GCS change or made the GCS already lower. So this is where you're going to fill in that section. It's going to populate your GCS total and a revised trauma score. You don't need to worry about putting those in. Level of responsiveness. Were they alert? Do they respond to pain? This is a section you can go through and put that in. Pain score. Let's say it's a 6 out of 10. Stroke scale. Excuse me. I'm having a stroke. Stroke scale score. Negative. If I put it in as positive, you'll see over here this patient assessment flags, something we talked about earlier. If we went through and did a stroke scale and it was positive, it's going to want to know date and time of last well known. So be aware of that. You might have to go back into your parameters over here. The type of stroke scale that was given, temperature if you took it, temperature method if you took it rectally, if you took it orally, anything along those lines. Vitals waveforms, this will auto-populate, and then an APGAR score if you have a newborn or infant. So all of this is good information you can go through and put in before you go through and do your narrative. Now you'll see there are vitals, now that they're at the right time and they're complete, this is accepted. Moving on to airway confirmations. Let's say we want to go through and add one in. For some reason this is not flagging as the wrong time, but let's say we did this at 9:57. What did we do? Did we do an ET tube? Did we do some other invasive airway? Did we do iGel? Let's say we did an ET tube. How did we confirm it? Was there auscultation, waveform ETCO2, gold standard, chest rise, visualization of vocal cords? This should be able to be a multi-select response. Let's say tube death. We'll go 22 with teeth. A type of initial or individual confirming airway device placement. Was this confirmed by another person, just by the person performing the intubation, or was there an other? So we can go through and select those if we need to. We can also go through and say that Connor dropped this tube. Was there any airway complications encountered? Was there bradycardia afterwards? Was there a cardiac arrest? Was it a failed intubation effort? These can be input. Suspected reasons for failed airway procedure, we can go through and do. Was there facial or oral trauma, inability to expose vocal cords, jaw clenched, so another good area to go through and document your airway drops. Medical devices down here, this is going to be pertaining to the ECG values. And if you go through and take one and you transfer them over, which we're going to talk about next, this should auto-populate, and it might have a flag or two for what we want to go through and take a look at, but just to kind of give you an idea of what this looks like if you're going to manually input it. Okay, backing up for a second, we've taken out all of those assessments, procedures, medications, vitals, and everything to go through and show you a different way to input these. You'll see now that the vitals is now flagging that it needs this area complete. So we can go over here to assessment. Assessment was our first one. We're going to use this power tool. Let's say that we are going to say our skin, our mental status, and neurological assessment are normal. So that's all got the thumbs up. That's all good. Okay, we hit OK. This now populates that. Take a look, though. It's the wrong time, and for some reason, this is not going through and flagging for the ImageTrend software, but let's just say that that's OK for the moment. If we're going to go through and do procedures, we can open this up for procedures, and we can find all these different values in here of what we did. Did we do BVM stuff? Did we do ETCO2 monitoring, finger sweep? All of those things can be put in. You want to go up here and put in the crew member that's doing it and make sure that your date and time is correct for that. Let's say we're going to eliminate that one for the moment. Your medications. Medications can also be found in here in this all button, and meds. This is another area where we can go through and just say adenosine. We put 6 milligrams by IV. Yeah, there we go. Site, where did we put it? Response, improvement, unchanged. Those things can be completed in there. So this power tools section is going to be cleaned up a little bit, but this is a good area for you to go through and input some of this information. Okay, now we're going to back up again and show you a different way that we can do this. And if we all train this way and start to get pretty used to sending the vitals from the LifePak to ImageTrend, this will auto import a lot of this stuff already. So we'll see up here the save button, print, PDF, CAD, and EKG. If we go through and update or open this, this is going to give us all the calls that have happened that imports have come in from the monitors. So let's say we're going to select engine 131 on 11/28. This is going to be out of time just because it's not being sent right now. And it's going to get the case from the cloud. You'll see a lot of these things are going to go through and change now, and it's going to be out of sync, but that's why we're showing it to you last. If this is done in process or right after your call or before you shut off the monitor, all of these times should sync up a lot closer. But right now, looks like we had a med device power on and it took some vitals from us. So now we can see there's vitals down here, but it's still flagged. I wonder why. So let's take a look. Oh, look, there's the time. So this was 12/2/2025. And let's say this was 09/58. That clears it. Okay, we can go through and update anything. Again, respiratory rate, 16. Interesting. GCS, we can go through and put these values in too. Real, just a couple quick little clicks that'll add up a whole lot of other information. This will also bring in our waveforms. Hey, what was going on? There's our SpO2 that we were needing, and it'll also give you any EKG or any other device use. You'll see down here the medical device is populated at 106 today. Let's go through and change that. And then because we didn't really have an EKG waveform, it didn't populate on here. So if we have all that information now our provider actions is blue. So we can do that one from manually input from this field. We can do it from the power tools on the side, or we can also import data from the EKG service and then also say if we did any other procedures that weren't documented on the LifePak. Just to show you what it would be like if we had a larger set of vitals, we'll go through and take these off as well. Go back to that EKG and let's see if we can find another one. So now we can see that a 12 lead was obtained. If we scroll down here, we can take a look at 12 lead ECG. Open this up, and this is going to give us waveform and numerical data that's coming from the LifePak. So just be aware this can be as full as we go through and make it if we utilize the LifePak as best we can and say that there's an event or that a procedure was done right on that page. This will automatically populate when needed. Okay, we're just going to keep those in here at the moment, and we're going to go to the next tab. So provider health and safety. There's two different spots here. This one is not required. This one is required. So this is a great area that can go along with work comp. So let's say that Connor went through and it shows it's already going to auto-populate that he was wearing gloves because he does it for every call. We all know that. But down here, was there a suspected EMS work-related exposure, injury, or death? If we hit yes, we can go through find a value. This could be body fluid. This could be a needle stick. This could be injury. All those things could be input into this situation, and that should help trigger some of that work comp information and documenting right away. Let's say, and down here, close calls. This is an internal piece that we're wanting to track from the admin. So if we click this value, this is no close calls occurred during this incident. You guys will recognize this list a little bit from New World. This has been auto put in. So if there was nothing that happened, we can put this in. If this driving close call is a new one, and this is not necessarily from the rookies driving around and possibly running into things, this is, what, did a car come out of nowhere? Did we have to swerve? Was no one obeying the code 3 rules on the road? This can be input as well. You can see it's a multi-select. So if it was a patient was combative or someone else was combative in a crowd at a concert, all of those can be placed in for our own checking. Okay, now that we've had no close calls and we've documented Connor's work-related exposure, we can move on to transport. So this next tab over here, destination transferred to facility. Was this community? Was this St. Pat's? Some of these others are going to be cleaned up and taken out, but it's just going to be mainly these two. You can also go through and pick from this side over here as well. If it was not recorded, you can click not recorded. But the one cool thing about this part is that destination address is not populating. If we go in through in here and we say St. Pat's, this will auto-populate down here. So we just need to select, was it St. Pat's, was it community, or did we not record it for some reason? We'll say it's St. Pat's. This will automatically go to hospital emergency department. And then reason for choosing destination. Was this the patient's choice? Was this family's choice? Was this online on-scene medical control? These can all be input as well. Destination address will auto-populate out of the two that you have selected up above. And then transport information. We set up above that that Messi was transporting, so this will auto-populate. Did they go code 3? Did they go code 1? Did they upgrade? If we know the information, that can be put in. Was the patient moved by stretcher? This is going to auto-populate. This can change. Was there a delay transport? Down here is reason for refusal if we need to go through and document that. And then position of patient during transport with semi-Fowlers. If they are lying supine, this needs to be changed because you're going to be misreporting. So a few of these things will auto-populate. Just be aware that these are things that are going to come to light. Hospital activation, we're not necessarily going through and putting this in. It's just going to auto-populate hospital general. But if you had a STEMI activation or a stroke activation, trauma center activation, these can be input in this hospital capability. After that, you'll see that our validation score is 99. So if we click on this, it looks like we just need a narrative that's required. So over here is our narrative. We'll click on this. And then this is where you can go through and free type in your D chart that you've been trained on before to use. However, there's also some things over here that you can click on and we can say D chart and generate. This is going to want to have a couple extra fields that maybe we didn't fill out. So dispatch priority was code 3, and let's say the transporting agency was Messi. We hit OK. And now you'll see that this auto-populates. Let's talk about this for a second. This is done by the system by values that were put into this. This does not mean that it's perfect in any way, shape, or form. So you want to review this. So your dispatch, 161 was dispatch code 3 to this place for a patient experiencing sick person. So again, not great. 161 responded emergent with no delay. So this is all taken from information that is found on this left side, including this chief complaint. So if we go back in here for patient assessment, and we don't put in something here for complaints, this will not auto-populate. If you can also go through and just change. Let's say that's not actually accurate. Let's say this is days. And then the history is an area that you'll go through and want to type out and fill in. And then your assessment. Remember that a lot of your assessment findings are already included in this report. And then your treatments can be placed in here, and then your transport. Patient was transported code 3 to St. Patrick Hospital by Missoula Emergency Services, blah, blah, blah. You can click save, and then that'll automatically input it. Let's say you're not necessarily liking how any of this is done. You can go back through and you can click clear, and you can just start right over. When it comes to cardiac arrests, that's probably going to need to be a whole other section, but let's say we want to go through and see if we can generate a narrative. You'll see if I click this now, because we have not placed cardiac arrest in any of this other portion of this report, and I'll generate, there's a whole bunch more things in here that it wants to know, so it can help populate that. More to come on that later, but just so that you're aware. So let's just go back to our D chart, generate, and then we'll fill this out, and then we'll click save. At the moment now, you'll see that our report is complete. We have 100% validation. If there was an issue or you saw that we weren't at 100% validation, you can go through and click that button down in the bottom, and you can see, oh, we need the narrative, and you can click on this little button and it'll take you right to it. You'll notice that we didn't talk about this signature page down here in the lower left corner. We're still trying to find out what is required by the state and what is required by the feds for us to be able to have refusals or other signatures from personnel and staff on scene. So at the moment, we're 100% validation. Everything's blue. Everything's looking good. You'll see down here in the lower right-hand corner the status button. So this is going to pertain to everybody who's not a captain or acting captain that's approving reports at the end of their shift, so to speak. So right now, this is status report in progress. If I click on this, you'll see that I can move it to needs captain approval. This will then automatically have it save up here. If you don't feel comfortable about it, save it again. Now this report is telling the captain, hey, time to go through and approve this whenever you get a chance. Then you'll go up here and you'll click close. Once this opens back up or comes back to this EMS incident list, you can see that the report I was working on right here, 1665 Milwaukee Way, needs captain approval, while all these other ones are reports in progress. So we'll talk about that with the captains and the acting captains in the future, and that's been a full PCR report.